Hi, I'm Sam Brentano, Marion County Commissioner, and I'm supposed to introduce what we've been calling Marion County Today, where we talk about different things going around Marion County. And today's program is going to have to do with the Marion County Community Health Assessment. And I have Rachel Posnick, as I've been told. She's epidemiologist for Marion County. And could we start by just talking about you a little bit and where you've been, how you got here, etc.?
I suppose so. So I've been working for Marion County for almost 2 years. As Commissioner Brentano said, I am the epidemiologist. I'm from Colorado originally. I moved here in 2010 and completed my master's in public health at Oregon State University.
Which is good.
Yes, go Beavers. And I started working for Marion County Health Department in 2013.
So I've seen this assessment come through. I'm making this up a little, about every 2 years, and I think that is the pattern. Is that how often it's done?
The entire assessment process is done every 5 years.
Over
and
5 years.
Time
flies, yes.
Yes, but we do provide updates to it every year.
All right.
Because we're constantly collecting new health data about Marion County.
So this is more significant than I thought. This is a picture of what's going on in Marion County for a 5-year period.
Yes. So the purpose of the assessment is to really learn about community health. So chronic disease, communicable disease, quality of life, all of the things that contribute to health in a large community. And we're also really interested in learning about factors that lead to inequity in health among populations. So if there's a certain geographic area that's having trouble accessing something, or maybe they experience a higher rate of disease, that's the sort of thing that we're trying to look at with this widespread community health assessment.
Well, I know all these questions aren't really what I'd call health, and I think that's what you were just getting at.
Yes.
There was one that I became alerted to a number of years ago. It wasn't health related, but in a lot of ways it is, and it was the third grade reading scores of Marion County compared to the rest of Oregon. And I know they were low then and know they're low now. I happened to look back, so it says 2012. I think they quit taking or compiling that data the same way. That must make it hard to do a assessment where the factors can change each time. But I know that anyway, the point is there's a number of things that aren't just health, but it does give a real snapshot of what's going on in Marion County.
Right. And we are interested, sometimes we call them socio-demographic or socioeconomic factors, and that would be like the third grade reading level. Things like that indicate or are associated with different health patterns. So if people have lower education, they're more likely to live in poverty, and therefore they're less likely to be able to access things that we know contribute to better health. So maybe they live in a poorer neighborhood, they don't have access to a park, so their kids aren't getting physical activity. So there are different indicators that we look at that can lead to or are associated with poor health outcomes. So that is also a focus of this. And because coming from the health department, we aren't necessarily experts in all of these things, we have found it really important to get community partners involved with this assessment. So we don't ever do it just by ourselves. We convened a steering committee that had the local hospitals, the CCO, Early Learning Hub, the Community Action Agency that helps with Head Start. So we convened all of these groups to have access to different types of data that aren't necessarily related to health, but also to tap into their expertise about what's happening in the community so that we have a more well-rounded picture of Marion County.
Rachel, were you actually on these committees to put it together, or you
Yes.
just compile it? So,
so
you think this represents what you heard in your meetings?
Yes.
Okay.
I convened and facilitated a steering committee that went through this whole community health assessment process with the Marion County Health Department.
Okay.
So those partners that I listed were at the table. They helped us decide what indicators would go in here. They also helped us to distribute a survey that we did with the community and also with community partners about their health and their access to healthcare services.
They wanted me to ask a question. I think I'll ask it a little bit different, but how do you get this after you gather this information, how do you get it out to the community? Obviously, being here today would be one way, but
Right.
do you write excerpts of what strikes you as important and to get it to the paper? Or how do you get the information out, and what do you do with it?
I think hopefully, Peter and Pam will talk about this a little bit later in this program, but we held community forums. We were present at the Marion County Fair to talk to people about these results, ask them what it means to them.
But would you finish that up? I think it interfered with you. So you covered it, so you've got it out every way
Yes,
you can.
I mean, we hope so. We're still working on doing a couple of focus groups with different groups of people, and that will all be included in this health assessment, their feedback.
So you were intimately involved in putting it together, getting it out to the community. What would you, and I don't mean if it takes anybody else's questions in this presentation today, but what strikes you as interesting, or something we need to alert people to do something about, or even be proud of? I don't know. What is it? What strikes you?
I do think that hopefully Peter and Pam will talk about this in more detail, but my most exciting thing I found in the assessment is we surveyed the community in 2011, and we surveyed them again in 2015 about access to healthcare services. And we saw a huge improvement in people saying that they had access to healthcare services. So I felt like that was very exciting, because having access, feeling that you have access, and reporting that you have access, then hopefully
that was an improvement that you see.
Yes, an improvement, and hopefully that will lead to better health outcomes, because more people are seeing their primary care physician and are hopefully having preventive treatments, getting feedback about nutrition and physical activity and those types of things.
All right. That pretty well covers the questions we were going to ask, and I'm sorry if we're a little bit short on time, but is there anything else you'd like to say before we move on?
I mean, I just...
Put you on the spot.
No, that's fine. I guess I just want to acknowledge the fact that we could never have done this without our community partners. They helped us develop the surveys. They helped us distribute them. We collected almost 2,000 surveys from all over Marion County. We had people from every city in Marion County represented. In the survey feedback, I was talking to people that work at the different little cities. They were very interested in participating and interested in seeing the results. So I felt like it was a great collaborative effort, and hopefully Marion County will be interested in coming back and looking at the assessment and seeing their results on paper.
All right. Well, thanks for taking your time this afternoon, wherever we are. And I'm real happy you're here with Marion County. I've been concerned. I'm the bird flu king of Marion County, but I've always been worried, and that's the one thing that can really foul up a county or society. So you'll be the one watching, and I appreciate that very much.
Hi, I'm Kevin Cameron, one of your county commissioners, and I'm here with Peter Davis today. He's the program supervisor for rural and preventative services at the Marion County Health Department. Welcome, Peter. It's good to have you here.
Thank you. Happy to be here.
Why don't you start off? We were just talking off camera about all the degrees that you have. Why don't you tell us a little bit about yourself and how you ended up here at Marion County Health Department?
Sure. I'm kind of an educated fool. So I am an Idaho boy pretty much, and I graduated from Idaho State with undergrad degrees in Spanish and International Studies, and then I hung out there for a little bit more and got a master's degree in medical anthropology and one in health education. And then I did some research. I'm like, I can't do the research thing. I don't want to do the research. So I ended up getting my MSW from Northwest Nazarene University. And after that, ended up moving to Oregon and started working for children's behavioral health as a therapist. And then I'm like, I've always wanted that doctorate. So I went back to school to Arizona State and got a doctorate in behavioral health. And I just graduated about 2 years ago, maybe a year ago, with that doctorate. And at that time is actually when I got into this position as the program supervisor. Before that, I was a clinician working with kids and children's behavioral health here in Marion County.
So tell us a little bit about what you do as your clinician your current position. Tell us a little bit about what your daily activities is.
So
you
my
do?
daily activities are a lot of meetings and a lot of signing papers. What I do is I supervise several different programs. I supervise teen pregnancy prevention. I supervise drug and alcohol. I supervise TPEP, and I supervise gambling prevention. And so we go to a lot of meetings. We do a lot of work with community partners, really engage the community. We really help with the Strengthening Families program, which is a pretty well-known program here in Marion County. There are classes to help parents learn healthy relationship skills. And also we do stuff like work on the community health assessment.
Good. So you've been involved with the community health assessment. From your perspective, in that assessment, what do you think are our community's top health concerns?
Well, with the community partners, we talk to community partners and we also talk to individuals. Community partners include faith-based organizations, hospitals, and businesses. And so their top concerns are mental health, access and affordability to care, as well as obesity. And so those are what our partners see as the biggest issues right now. And individuals in our community, when we send out individual community health assessments, they add up pretty closely. And so it's obesity, access to health care, and then substance use. So substance use and mental health are the two separate ones that are different between those two.
Yeah, so the difference between individuals versus your community partners.
Yeah.
How about, did you notice or have you noticed anything difference between the rural areas of our community, because Marion County has a lot of rural areas, and then the urban, the Salem-Keizer area? Any differences in some of the top concerns there, or were they similar?
I really haven't looked at the data of that, and I haven't seen it configured in that way, but I know that access and affordability of care is a big issue in the rural areas, especially, getting to primary care clinics. If you live 10 miles away from the closest town, that's difficult to get to if, maybe you don't have a car or you don't have the money for the gas to get there.
I know in one of our commissioners' town halls, we were up in the canyon, and I think we heard a little bit about mental health care access and people having issues with access to mental health care providers as well. So those are some of the challenges there that we know about. So what are the most common chronic conditions that you see?
So in the community health assessment, we asked people, what are chronic conditions that you have going on? Arthritis actually came up as number one, which I thought was a little bit surprising to us, as well as high blood pressure, which isn't so surprising, obesity, depression, and chronic pain. So those are what people reported as being some of the top chronic illnesses that they thought were issues or that they were experiencing.
So did the county choose, or have you chosen those priorities based on the feedback, or how have you chosen those priorities?
Well, we have priorities that we've chosen as a group with our partners to work on.
Okay.
And those are different than what the community has said. Some of the things are different than what the community has said are their chronic conditions. So what we've decided to work on as a community, so all of Marion County and our partners, is obesity, prenatal care, depression, and I just skipped my mind.
That's okay. I'm sure our next guest will probably fill that in for us.
And tobacco.
Tobacco,
of course.
right.
The big one, tobacco.
Right.
So we got together and we decided to work on those together. And we decided really to do that because we have a lot of resources around those health indicators, and we have a lot of things that we can do in order to work together to kind of create a synergy so that we can make a big impact on them.
I know in the tobacco front, the county's going tobacco free in all our county properties. Started, I think, July 1st, and will be over the next year, or even some of the more difficult places where we have 24/7 coverage, trying to phase that in and encourage people to change certain behaviors. So it'll be interesting to see how that goes and what kind of results we get from a health standpoint.
Sure, yeah, we're hoping that doing policy sorts of change like that will make a huge impact, especially on the health of our younger people who may be exposed to tobacco at certain areas around the county properties.
So from the results of this assessment, have you noticed any, of course, 2011 I think was the last assessment that was done. Did you notice any large changes, any changes in the health of our community from your perspective in this assessment?
Well, actually, Rachel kind of talked about this a little bit before and stole my thunder. We see more access to health care. And
That's okay. Commissioner Brentano steals mine all the time too, so it's all
Right,
right.
we have that problem. We'll start a support group. So
Is that listed in here? New support groups.
right, that's number 6 for issues. And so really what we're looking at is more people have access to healthcare, which is great because we know that healthier populations do better in school. They have healthier economies, et cetera. And the one issue that we did find though is that there's still an issue to accessing dental care and eye care. So people are going to primary care doctors, which is great, rather than going to the emergency department, and that saves a lot of money and really helps with preventative care as well. But in terms of eye care and dental care, people just don't have access to that. And we really haven't looked at why that is. It could be a lack of providers, it could just be difficulty getting in, or it could be a lower sort of priority than primary care. So, if you're bleeding, you're definitely going to get that taken care of first than if maybe your eyesight's not so good.
Right. Well, is there any challenges that you want to talk about or that you see personally that we need to really share with the public that would help us move the health of our community forward before we end today? Anything on your mind?
Well, I think a lot of what we need to do just as a community is work together in order to create safe spaces and places where people can be healthy, start walking groups, take some personal responsibility, and work together as a community, not just for ourselves but for everyone. And if you see someone maybe who you think would be a good walking partner, start a walking group with them, support people if they're trying to make health changes. I think it's very grassroots and it goes up and into the policy. And so I think there's many different levels and there's a lot of things that individuals could do as well as organizations, and it's just really finding what you're passionate about, which your organization is passionate about, and going from there.
Great. So different organizations can help by how they put programs together,
Sure.
as well as us as individuals, trying to admit our strengths and weaknesses and to each other, and then helping each other get together and try to stay healthy. So.
Absolutely. That support is huge in any sort of health behavior change. And then for organizations, if a person's trying to change their behavior and they have personal support as well as organizational support and family support, it's going to be a lot easier for them to do that.
Well, Peter, thank you very much for the work you do for our citizens and for being here today to share information to help us get healthier in our community. Thanks a lot.
Thank you.
Hi, I'm Janet Carlson, Marion County Commissioner. I'm the third commissioner on this program about community health assessments, and I'm here with Pam Hutchinson. Welcome, Pam.
Thank you.
So why don't you tell us your title and what you do at Marion County Health Department, and also how you got to where you are.
Okay, well, I'm Pam Hutchinson. I'm the Division Director for Public Health with Marion County Health Department. I'm a nurse by training, and I came here originally in 1977, which is a long time ago, and then took a break to have children, and I worked at Silverton Hospital for several years. I've been back at the health department since '99, and I've actually worked in every position at the health department that a nurse could have in terms of each level, and now I'm the division director. So.
Very good. So we got a lot of great information from Rachel and Peter about the community health assessment, but I want to take us back because you were actually on this program talking about community health assessment several years ago on How Are the Children. Do you remember that?
Yes,
and we
I
had
do.
Maggie Hudson. I remember her from Santiam Health, and I don't remember
And
who was
Sharon
from
Hoyer from Salem,
Salem Health,
Yes.
right. So we've built this community assessment really on a great foundation of collaboration. So can you recap a little bit how that relationship got started with the area hospitals? And I remember it ended up in that lovely kind of glossy orange report that I kept taking pages
Yes.
around to all the state of the county meetings.
Yeah, originally we had done an assessment in 2008 when we had partners at the table, but we realized that we needed to really involve the hospitals because they were kind of catchment areas and they represented different regions of the county. So they agreed to come together, and we brought the group together to do the assessment. And I think we've built on that relationship because they're still back at the table and helping to provide leadership to the process.
And so it is a little bit different depending on if you're out in Silverton or in Salem or whatever, working with those. So can you kind of speak to the rural-urban differences that you've seen?
Well, Rachel or Peter alluded to the fact that if you're out in the rural area, there is a little bit of a difference in access to health care. That's one of the big things that we notice. When we were doing our Community Health Improvement Partnership, or CHIP, We also recognized that there were real differences in the communities in terms of resources that they could bring to the table, and kind of the partners that were willing to be involved or interested in being involved. So we tried to customize it. This time around we're using a slightly different approach, and we're having a one county steering committee, and we'll be working individually with some partners out in the outlying county as they want to be involved.
So Rachel said that 2,000 surveys came
Yes.
back or went out? I was
No,
trying to catch it.
came back,
right?
and actually this time we did find that we had a lot more electronic involvement. I don't know if Rachel mentioned that already, but yeah, a lot of people did the survey online, which was interesting, a trend that we're seeing, I guess. And yeah, we had a lot of responses. It was good, more than ever.
So you're going to do another online survey probably within the next few years then, right, to update
Yes.
this? So if someone is listening and they said, wow, I didn't get to do that survey, they just contact the health department, or how do they get on the email list, or how can they be someone, or do you have to actually go on the website?
Well, we had two different ways. We emailed it out to community partners, or people that we had on our lists, and then people who had participated in the CHIP in the past years, we sent it to them, and then we put out notices that it was available on our website, and we sent it out on Twitter and Facebook, through social media, so that we could get participants that way. And it really boosted the numbers this year. I think a significant portion were electronic.
So they could like the health department's Facebook page, and then they would get all that information. Is that right?
Exactly.
There you
yeah,
go.
Thank
So
you for
we're-
mentioning that.
Right. Okay, that's really good.
We're up to 1,000 likes.
So, so you just mentioned CHIP,
Yes.
Community Health Improvement Partnership. Is that what that stands for? Community.
Most places mean or say Community Health Improvement Plan, but here in Marion County, actually it came out of the South County, Staten, Canyon area group. They named it the partnership, and we just carried that over for the whole.
So how is CHIP different from the Community Health Assessment?
So the community health assessment informs the work that the CHIP does. So we look at the rates, and that's how we initially chose the priorities back in 2011, which were access to early prenatal care, women getting their health care in the first trimester, obesity, were two of the primary ones that we worked on, and so that was based on the data. And so those continue to be priorities for us. And actually, at this time, part of the partnership involved the local CCO, Willamette Valley Community Health, and also the hospitals, and then Polk County's been at the table, because we're in the same CCO region, so it seems logical to partner on efforts and maximize the impact. And so we all agreed on the priorities, so we're all working on them. The CCO is working with the OHP population, and the two counties are working with the community.
So we're getting a little bit of alphabet soup. So the CCO is the Coordinated Care Organization.
Yes.
And so they actually help provide health care to people that are insured through Medicaid or the Oregon Health Plan, which is
Right.
OHP. And if I'm recalling, by law, all of the Coordinated Care Organizations around the state, and there are a number of them, are supposed to do a community health assessment to base their plans and priorities on. And so how does this information we're doing inform that work that they're doing to really transform healthcare, integrate physical healthcare with mental health care and dental care, and that big vision that we have in Oregon?
So they were on the steering committee, and actually they used our 2011 assessment to create their first community health improvement plan. And Katrina Rothenberger from Polk County and myself are on what they call the Community Advisory Council, or the CAC,
Right.
for the CCO, for Willamette Valley Community Health. And so we have helped to bring that public health perspective on the data, so that they can use that to inform their plan. And then we've tried to align our plans so that we can get the maximum benefit as we work together.
Yeah, I think that's a great service, because as public health professionals, you've been doing this work for a long time. And I think there was some concern. I remember sitting in a meeting, because I'm on the board of this Coordinated Care Organization. They were saying they were going to contract out with some organization to come in and do a health assessment in Marion and Polk counties. And we're like, why? Why would you do that when you already have this great information? So, so this really kind of helps them build on what they need to do, and it's the work that you're doing already.
Right, so we bring that legwork, and Rachel's expertise as the epidemiologist, and our experience, because we do have a lot of experience in doing this work. And then they're contributing by the help to host what we called the forums, where we took preliminary data out to the community and shared it. and then they're going to help the booklet that you mentioned, the colorful one, that provides kind of more of a snapshot of the assessment. It's easy to read and it's colorful and it's got graphics. We're working on one of those that the CCO will help to fund, because the public health doesn't have the resource to pay for that, but the CCO can help with that.
That's great. So I was starting to understand why it's orange too. So I don't know if you're changing the
Oh,
color.
the
or not, but
beaver
you're right.
business.
Some of the comments that were made in the prior
Well, I guess,
interviews.
yeah, the past designer's husband was an engineering student at OSU,
There
but I
you
don't know
go.
if that's what it was.
Just must have been subliminal. So does the state make us do it? Are other counties doing the same thing in terms of their health departments, or are we unique in this?
It's different everywhere that you look, and I think we're fortunate that we had built some of those relationships beforehand, and actually that helped us a lot as we sought accreditation. I like to put the plug in for Marion County that we were the first health department in Oregon to become accredited, and part of it was the good work that we had done with partners and that we were able to demonstrate that.
And so are there groups around the county then that are helping then strategize about what we do with this information and how we get people involved?
That's the next step. I mean, we do have some ongoing work because we're continuing some of the same priorities, but we will be bringing a group together this fall to talk again about how we can work to collaborate. You know, 5210 is one of the things that's ongoing. We've got some work on prenatal care access that's happening with the CCO, looking at smoking in pregnant women, that sort of thing. We've got some beginning efforts, but we will be bringing a group together to work on it and make it more of a plan.
And if people want to get involved in those groups, who do they contact?
So we're going to post at the end of this presentation, I think, a slide that will give some contact information, and it will also have where you can go to find the full community health assessment. And if people are interested in the booklets after they're published, if they contact us, we can get them out, because we do want to distribute them far and wide.
Great. And always Facebook page too, right?
Yes,
It'll be on there.
exactly.
Okay, all right, great. Well, thank you so much, Pam, for being here, and for the others that came as well from your department to tell us this great information.
We appreciate the time. Thank you.
Thank you. And thank you for watching Marion County Today.